crippling computer systems at a major hospital chain. It's called Medstar Health, and it's forcing patient record systems offline for thousands of doctors, for nurses, and for the administrators. So what did the hackers want, and how is the cyber attack affecting you, the patient, and all of our care? Joining us now is Dr. David Samadi of the Fox Medical A-Team and cybersecurity analyst Morgan Wright. Thank you, gentlemen, for being with us.
Good morning.
Morning, Ainsley.
Good morning. Dr. Samadi, I'll start with you. As a patient, should we be worried?
Well, there's a lot of concerns about the patients because what has happened over the last couple of years, a lot of hospitals have joined. So now we see hospitals in the range of 10, 15, 20 different hospitals have joined and have become a mega healthcare system. And in the past 2 years, the federal government has pushed everyone to really go to these electronic medical records. Unlike the financial system where they're really well trained and their computer system is so savvy, a lot of doctors and healthcare workers are not really trained, and our computer system is kind of old-fashioned. So the hackers are getting in, and unfortunately, a lot of Social Security medical information is at risk. 1.8 million Americans have been exposed to this 2 years ago, and this is just the beginning of this.
Wow. Morgan, let me ask you about these medical records that the hackers are taking. I understand they get more money for medical records. Why is that, and who's buying it? Why do they want it?
Well, look, credit card records and I teach a lot of this, and I was in Dallas here about a year ago talking with insurance companies. Went to a black market internet site where credit card records are only worth 50 cents a record. Medical records are worth $50 to $70 because they have everything for identity theft. They have your name, your address, your social security number, your date of birth, your dependents. So these things become the golden eggs that these geese are laying. And I'll tell you, Ainsley, this is going to get far worse before it gets better because, as the good doctor said, the security at hospitals is so lax. I mean, they're still playing with technology from 10 to 15 years ago. These hackers are using tools from today, so that's why they're at a distinct disadvantage.
Dr. Samadi, if they did get our records, what do they do with it?
Well, what they're doing is they're using it for both Medicaid and Medicare to get a lot of medical equipments or make tons of money with that. They will use and sell, as our expert explained, they will sell this. There's a major financial incentive. And also there are hospitals that are actually paying this in order to be able to get their system back. So this is creating a big incentive for hackers out there. I think the message to a lot of people out there is to be careful, especially patients. Be careful when you give your Social Security, because once you give that information to doctors and hospitals, you just don't have control over that. And make sure that you look at your EOB or explanation of your benefits and find out if there are things that is correct or not. Did you go for that procedure? Is it everything looks kosher? The labs, etc. So tons of information out there, and I think because we have rushed as a result of this universal healthcare system and Obamacare, hospitals have rushed to get into this electronic medical records. Next week we're going to have e-prescriptions, and a lot of doctors are confused about what to do with this whole thing. There's a lot of gaps, and unfortunately these hackers are getting in and taking a lot of advantage of both healthcare system and patients. We've got to be careful.
Morgan, what is ransomware?
Well, you guys have been covering the hijacking in Egypt. It's almost the same thing. You hijack somebody's data, you hold it for ransom, and what it is, it gets in through, as Dr. Samadi was talking about, the healthcare industry is not well trained, so they don't recognize spear phishing, which is deceptive emails targeted usually at specific people. You click on a link like a PDF document or a Word document. Next thing you know, your system's infected with this malicious software called ransomware. It encrypts the data, holds it for a secret key. And Ainsley, this stuff is so difficult to get rid of. Even the FBI has said your best recourse, which they did at Hollywood Presbyterian, is just pay the ransom to get your data back, because a hospital is a business. It cannot run without its patient records.
Ainsley, a lot of times the doctors are being trained by either administratives or people who will come in and give you just the technical part of how to use the software system. I think that's not good enough. We really need to be trained by experts in the field who know about IT system, who know about security, and by the people that can train us how to shut down your system in case there is a virus, etc. This is a very complicated system. The healthcare system needs to really jump on this very quickly before it gets too late.
And there's too much at stake here. All right, thank you so much, Dr. Samadi, Morgan Wright. Thank you for being here this morning.
You bet, Ainsley.
Thank you.
All right.